Hello and welcome to another episode of the NK Active podcast. I'm Nick, podiatrist director here at NK Active. So, December 23, we are going to do something slightly different this episode. It's all going to be around about osteoarthritis, what causes it, and over the next few months, we're going to delve deeper into that as well. But I thought, let's try and do something slightly different. So, what we're going to do is I've prepared a presentation and I'm going to run through this presentation. I'm going to speak through it also. If you're listening to the podcast, you're still going to get everything that you want, but then you can then always go and watch it on YouTube later on and then follow some links to some helps and tips as well. I'm just trying to see if this is a better way to try and help teach people around osteoarthritis. So here we go. I'm now going to share my screen. So when we now look at osteoarthritis, what is it? What causes it? So before we get into what is it, I think it's a really interesting fact that osteoarthritis affects more than 300 million people worldwide, and that number's growing, and it's considered one of the fastest growing and burdened sort of conditions on the human body and us as a population. And it's something I feel just always just gets brushed under the carpet, which I don't feel is right. And there's a lot of myths out there and misconceptions. So hence why this episode has come about. And obviously, if you want a more in-depth conversation, have a look to a previous podcast episode where we had Professor Kathy Bowen on board, talking about arthritis in more detail on some of the research of what's going on. So, what is it? Well, let's start off with what it's not. It is not wear and tear. This is something we're trying to phase out. We used to think it is wear and tear of the joints, and that's not actually correct. We're now talking about wear and repair. So what do we mean by this? So if we think of osteoarthritis, that basically it is you get some load to the joint, you get some wearing and load through the cartilage of the joint, so sort of that shiny surface that sits over the top of the joints. And what should happen is when you get wear to that surface, the body sends the messages, oh, something's going on here. Now let's go and send all the right messages to repair it. And what osteoarthritis is, that repair process is not happening. So how do we look at diagnosing it really? Well, you can use X-ray, and X-ray is still a really, really useful way to look at osteoarthritis. However, advances in imaging is started to show us that actually we may be able to pick up osteoarthritis earlier with scans like MRI scans. And now, I'm not suggesting that if you think you've got osteoarthritis, you need an MRI scan, because that will just clog up the system, and I don't think that's the right approach. But we can start to see changes to the joints. And some of the researchers look at these changes and look at how they develop over time, and we're starting to see that you may be able to pick up osteoarthritis earlier in MRI scan. And what's also really interesting is there's some research looking and suggesting, well, if you pick it up early, and you sort of attack the factors that are maybe causing arthritis in the first place, then it's possible you may be able to slow the progression of osteoarthritis down. Isn't that amazing? But the research is happening, and hopefully we'll know more as time goes on. So if we look at some of the myths, we know that things like running, jumping around doesn't cause osteoarthritis. I think we're now finally turned a corner of the old running's bad for your knees, running's bad for your back. We just know that it's just a load of old rubbish, and it doesn't cause osteoarthritis. In fact, it actually may be slightly protective of osteoarthritis. We also know that if you've got osteoarthritis, one of the worst things you can do is sit around and do nothing. Now, we also appreciate and understand that doing certain things may cause too much discomfort, or the joint has got stiff, you can't do an activity. That doesn't mean we have to stop completely. That means, okay, let's take a step back and look at what we can do and keep moving. It's that whole saying of motion is lotion. So sitting around doing nothing isn't that helpful at all. So what causes it really? Age is a big factor. We know this is a problem that affects us once we get past the age of 40. It can happen earlier, but the majority of the cases is 40 plus. We know gender. We know that females, unfortunately, are more prone to getting osteoarthritis and having more severe symptoms than men. Previous injury to a joint. So if you've had a fracture or you've had an ankle sprain, we know that can put you at more risk of getting osteoarthritis. Obesity. We know that obesity is linked to getting osteoarthritis, especially in the big joints or in the lower limb, around the knee and the hip. And genes, you can choose your friends, but not your family. We know there's also a genetic component to osteoarthritis as well. There is some talks around diets and foods and everything along those lines, but there hasn't actually been any proof to say that one particular diet will cause osteoarthritis. There is some talks and sayings around about certain foods may irritate it and flare symptoms up. But again, we're still waiting for the good amount of evidence to come about. And if we look at the age factor, we know that from when we're born to the age of 30, our body is constantly getting stronger. Biology is on our side. Unfortunately, we hit 30, it's all downhill from there. We know that this, what we call sarcopenia, starts setting into this reduce of muscle mass. And that starts to go on the decline from 60 to 30. And then once you hit 60, that rate of progression then doubles. So is this a link between why osteoarthritis is more prevalent as the older we get? Because all the time from 0 to 30, the biology is on our side, really. And we know that when we look at osteoarthritis in the foot and ankle, for example, we know that all the patients we see in clinic, and the research supports this as well, they tend to have a reduction in strength within the ankle when we test them in clinic for those that have osteoarthritis. So I do think there is that link between, as we get older, we tend to lose a bit of strength and osteoarthritis creeping up. But it's not all doom and gloom. There are some positives along the way as well. And we'll come on to those in a bit. But what does it feel like to have osteoarthritis? What are the symptoms? So most commonly you'll say, okay, everything feels stiff. Everything feels stiff in the morning. I get up, I feel good, 20 years older than I am. And once I get moving around, things loosen up a bit. Within the foot and ankle, pain on uneven ground. If you've got osteoarthritis in the ankle or anywhere in the foot, uneven ground's not your friend. You may look back and say you played a lot of rugby, football, hockey, had lots of ankle injuries, knee injuries in the past. That's not going to be helping you either. You may have noticed there's some bony lumps. If we talk about osteoarthritis around the big toe joint, you can often feel that there's these hard lumps starting to occur around the joint itself. And that tends to be bone and what is known as osteophytic change. This is the body trying to grow more bone in response to the arthritis to try and help protect itself. We know that when you start moving the particular joint, it's going to be irritated. So if you take osteoarthritis of the big toe, doing things on tiptoes or wearing high-heeled shoes, for example, isn't going to be helpful. And then with the foot and ankle, you tend to find the more supported the shoe, the more comfortable things tend to be. So management and treatment of it. We know that strengthening work tends to be helpful. Now, we know strengthening works. However, we haven't actually yet proved about specific exercises. And I'm not sure we ever will, because we'll come on to it in a minute. But also, I think with osteoarthritis, it's not about just the injury or the arthritic joint. It's about the person. So I think this is where there's a large education component about breaking down some of those myths, looking at the overall factors in someone's life, and then looking at, okay, what can we do to try and help keep someone moving and educate them along the way. So because you're going to be living with osteoarthritis, we want you to be in control of it rather than it controlling you. We also know with osteoarthritis of the foot and ankle that there are certain insoles can be helpful. Shoes with a stiff rocker sole, for example, or even some examples using a brace can be helpful just to remove some of the pain and keep you more active and keeping you moving. And the pattern and the important part here is just keeping you moving. Sometimes the joint's a little grotty and it's still painful even if you got stronger, so an injection can sometimes be helpful. That will either be a steroid injection or something in the line of Ostenil, which is effectively like WD-40, or you may have seen them on the TV adverts, a skincare product, hyaluronic acid. That's what Ostenil is, and that can be helpful just to lubricate the joints a bit as well. So when we're thinking about this, I alluded to it earlier, is that actually when we're thinking about arthritis, and this isn't just about the foot and ankle, but if we got it in this, we got to think outside the joint that is injured. So I got to think, we got to not worry about the problem. We got to look at the whole global picture, I think. Because we have to remember whether it's a foot, whether it's a knee or a hip, that is attached to a person. So we need to try and help both. I think if we just focus on the arthritic joint, and we can be guilty of this in healthcare, of saying you come with an arthritic ankle, let's just worry about that. Without actually sitting back, asking the person, okay, how do you feel about this? What do you want to do? What are your treatment goals? What activities do you want to be doing? What's the next 5 to 10 years look like for you? Those sort of questions. And I think we have to take the whole person into consideration. Because Dave, our rehab therapist, who's been on plenty of the episodes before, often asks the question of, right, if we can solve your foot or knee pain, do you feel the rest of you is in sort of good enough order to do what you need to do? And a lot of the time the answer is, well, actually, maybe not. There's always work that can be done. Because when we speak to some of the patients who have osteoarthritis and present to us in clinic, they may be coming in with a foot problem. When we speak to them, some of the words of the language they use isn't foot related. It can be, I'm not as confident anymore. I'm older, so I have to be more careful. My friends and family are telling me, oh, Dad, you got a touch of arthritis, take it easy. Or I'm nervous about doing something and making it worse. Or that my joints are just worn out and I can't get stronger. Now, so you can see a lot of the language that's being used here isn't about the foot, it's more about the general global picture. And I think that's what's really, really important, to take the person into consideration as well. So education is really the key when it comes to helping manage osteoarthritis as such. We know that as we get older, as I've shown earlier on, and we spoke about it, is that as we get older, biology isn't on our side. However, as I said, it wasn't all doom and gloom. It is actually the fact that as long as our heart's still beating and we're still breathing, if we give the body the right stimulus, it will always get stronger. And there has been some beautiful studies and research done out there. There's one done in New Zealand looking at people in their 70s deadlifting, so lifting weights off the floor. And by doing it, they reversed osteoporosis. There was a fantastic study, one of my favorites of all time, that looked at 3 different males. To visually look at them, they're all the same size. You had a 40-year-old triathlete, a 70-year-old triathlete, and a 74-year-old man who sat around and didn't do much. And they looked at the muscle quality of within the thigh, and they found little difference between the 2 active people, regardless of age. But the person who's 74, who didn't do much, the muscle had wasted away and been replaced by fatty tissue. So we know is that if you don't use it, you lose it. But we also know that if we get thinking about as we get older, it's more and more important to continue with that strengthening work, especially if you have osteoarthritis. And this is why also the World Health Organization have updated their guidelines, as it were, and now recommend we do 3 strengthening sessions a week. So if we really break it down, step 1 is to help reduce pain and symptoms. And that can be injections, insoles, footwear. And then we then transition of education around about osteoarthritis in the future. And this is then where the exercises and strengthening work comes in to try and then help set you up for the future 4 years to come, and trying to reduce the risk of any sort of potential surgery, or if surgery is inevitable, more of a case of getting you in a better position for surgery or prolonging that surgery for another 5 years so you can do things without the surgery and the recovery period impacting you, as it were. So bringing it all towards the end now, there is a fantastic resource called Versus Arthritis. And on there, you'll find a heap of information, support groups, what's happening in the research, all about arthritis, and not just osteoarthritis. A lot of it's about other musculoskeletal conditions. But for me, that is the go-to site and resource to look at. So to bring everything to a close, if we think summarizing is, we know osteoarthritis is very, very common. The person is the most important element to it, not the impacted joint. The education is absolutely paramount. You've got to keep moving, got to keep strong, and we've got to think outside the foot or the limb affected. So I just now want to say many thanks for tuning in. If you have any questions or comments, then please do get in contact. Please do subscribe to the podcast. As I said, there is a presentation element to this as well. So hop over to our YouTube channel and you can go view that. And we shall see you on the next episode. See you later. Bye.